Hi, my name is Namita Iso, and this is my oral administration checkup. For the first part, we want to compare the MAR to the physician's orders. So here we have the physician order sheet and the MAR. Our patient's name is Sam Smith. On the physician's order sheet, it says Sam Smith. So I checked with the physician, Dr. Stevens, and he says that his name is Sam Smith. The date of birth is 12/05/88. Here we have 12/05/88. Mr. Smith is allergic to sulfa and statins, and that is correctly on the MAR. He is allergic to sulfa and statins. Next, we'll go on to the medication. On the physician's order sheet, we have metoprolol 50 milligrams PO once daily. This is a beta blocker. And on the MAR, we also have metoprolol 50 milligrams PO at 9 a.m. Next, we have Coumadin 5 milligrams PO once daily. This is a blood thinner. On the MAR, we have Coumadin 5 milligrams PO at 9 a.m. Next, we have a multivitamin PO at 9 a.m. Here we have a multivitamin 100 milligrams PO at 9 a.m. I checked with Dr. Stevens, and he did say that he wanted a 100 milligram multivitamin. Next, we have a medication called cephalexin. This is not on the physician's order sheet, so I checked with Dr. Stevens, and he approves that he does want this medication to be administered. So we have cephalexin, 250 milligrams over 5 milliliters at 9 a.m., and Dr. Stevens would like this PO. Dr. Stevens said that this medication is for infection. Next, we'll be going to the Pyxis to dispense the medication. So when you get to the Pyxis, you want to make sure you put in your patient's information, and this is how the drawers will open up. So here we have the medication. We have metoprolol. This is a beta blocker, and it can help treat high blood pressures and heart rates. I need to make sure before administering this medication that the blood pressure and heart rate of Mr. Smith is within the normal range. I need to also remember that the onset of this is between 30 minutes to an hour. I checked the packaging, and the expiration date is good. Next, we have Coumadin. Coumadin is a blood thinner, and this can help treat and prevent any blood clots. I need to make sure that the INR lab result is within normal range. I also need to remember that the onset of this is 24 hours. I checked the expiration date, and this is good. Next, we have a multivitamin. This is used to supplement any vitamins. I need to let Mr. Smith know that this can cause an upset stomach, so he can take it with his breakfast. Next, I have cephalexin. This is an antibiotic which can help treat infections. I need to let Mr. Smith know that this can cause an upset stomach, so it's best for him to take this with his meal. I checked the packaging of all of the medication, and everything is good to go. So now I'll be entering Mr. Smith's room. I need to make sure that I take all of the medications, the cup for the pills, a cup for the cephalexin, and I also need to make sure that I take a cup of water for Mr. Smith. So before I go in, I need to put on some hand sanitizer. Good morning, Mr. Smith. My name is Namita Iso, and I will be your nurse today. I'll be giving you your morning medications. Could you please tell me your name and date of birth? Now I'll be checking this with your wristband. Thank you. And Mr. Smith, do you have any allergies to sulfa and statins? Okay. Now, Mr. Smith, I will be sitting you up today so we can see if you can swallow. I have a cup of water for you here. You may take a sip. Great. So, Mr. Smith, I have 4 medications to administer to you today. The first one is metoprolol. This is a beta blocker, and this will help lower your blood pressure and lower your heart rate. I have checked your blood pressure and heart rate, and it's good to go. It's within the normal range, so I can administer this medication to you. Next, we have Coumadin. Coumadin is a blood thinner, and this will help prevent and treat any blood clots. I checked the INR lab result, and it is within normal range, so I can give this medication to you. Next, we have a multivitamin. The multivitamin is used to supplement any other vitamins, and I need to let you know that this medication can give you an upset stomach, so it's best to take this with a meal. Next, we have cephalexin. This is an antibiotic which will help treat your infection. And a side effect from this medication is that it could give you an upset stomach. So it is also best to take this medication with a meal. Do you have any questions for me? No? Okay. So now I'll be putting on some hand sanitizer, and I will be putting on some gloves, and I will be dispensing the medication. Does that sound like a plan? Great. So first what I want to do is I want to scan your wristband with the medications to make sure it is in check. Great, everything is in check. So now I'll be putting on gloves and I will be dispensing these medications. Before dispensing the medication, I want to make sure that I put on my gloves. So we want to take our little cup. In here we have metoprolol, so we can take this out. Next we have our Coumadin. And then we have our multivitamin. For the elixir, we would usually have an oral syringe, but for today we'll be putting it in this cup. So we want to dispense 5 milliliters. And now we can give it to the patient. So Mr. Smith, would you like to take this one at a time or all together? All together? Okay. So in this cup we have your metoprolol, your Coumadin, and your multivitamin. Here's some water. And in here we have the cephalexin, the antibiotic. Great. So if you need anything, then your call light is here and you can always reach me. I'm going to come back within 30 minutes to check on you. Does that sound like a plan? Great. So when the nurse leaves the room, she needs to make sure that she takes all of her wrappings and takes back the multivitamin bottle and put it back in the Pyxis. She needs to discard all of her wrappings and throw away her gloves. And then after that, she can go and document the medication administration and the patient's response to the administration. Thank you.